All right, so now we're gonna talk about a few troubleshooting things that you may encounter while we're running VHIT. A few of them are patient-oriented troubleshooting things, and a few of them are operator, clinician-oriented types of things. So one of the first things you wanna make sure when you're looking on your screen is that you can see their pupil and their eyes are really wide. One thing you can do is if they can't open their eyes really big, sometimes I'll come here and I'll actually pull up on their eyebrow a little bit while the goggles are on, and that will actually open things up a little bit so you can see their eye a little better. The other thing is sometimes people blink a lot while you do this. So the thing with that is to try to re-instruct to keep your eyes open those eyes really wide, and then maybe even try to time it with their blink. So watch for them to blink on the screen, and as soon as they blink, then try to do the head impulse. So some of those things will help you overcome those types of things with your patients. When you're running VHIT on your patient, remember you're gonna put your fingers right on the front to get a good grasp, hands up high so you're not touching any part of the goggles or the strap. You don't wanna make big motions like this. It's gonna say too slow when you do that. And you wanna keep it really short. So a short, quick turn of the head like this when you do it. The other thing you don't wanna do is turn and then bring it right back to center. What happens in that case is it seems like in the computer that the eyes have moved, but the head did not go anywhere because you've recentered the head. There's no difference in where the head is now versus where it was at the beginning. And so you want to turn the head again quickly and stop in that position and give yourself a little bit of time in between impulses. So you don't want to also go back and forth so fast that it doesn't have time to read in between, and you're just going to get a lot of error messages, and so that can be frustrating. So give yourself a little bit of time in between. So again, you're going to impulse, hold, and pause. Impulse, hold, and pause. And again, give yourself a little bit of time in between. If you see goggle slippage, so you're gonna see that really on your tracings where the eyes are gonna be higher than the head. So the green lines are gonna shoot way higher than the orange head location on your tracings here. And so if you see that, you wanna make sure to snug up the goggles as much as possible, and also make sure that it's clipped to your patient on the side here like we had it set up earlier. That can help reduce some goggle slippage as well. If somebody has a ponytail like this, sometimes you can put the strap over the ponytail holder like on the lower end of it, and that can also help make it more snug on the head as well. So if you're getting a lot of goggle slippage, that can help. Again, you want to make short, quick movements as we're doing it. It will tell you if you're going too slow, and so a lot of times you just want to make sure that you're making short and quick movements, not long and quick, and not short and slow. So it's a combination of both, and it does take a lot of practice. So be patient with yourselves as you're trying to do VHIT.